Thank you very much, Josh, and hello, everybody. It is lovely to be here supporting XR Safety Week. So, as Josh mentioned, my name is Neil Ralph, and I work within England, part of our National Health Service. And I'll want to tell you a bit about what we're doing at a national level within England to support the way we educate and train our healthcare workforce, and particularly what we're looking to achieve through accelerating and scaling the adoption of XR technologies in support of that. So some of you might be familiar with the National Health Service in England. This is a nationalised, tax-funded healthcare service that provides care to our 60-odd million population within the country, from primary care through to secondary and tertiary care, meeting all of our healthcare needs. And it's costs about taxpayers about 140 billion a year we invest into delivering the National Health Service, and that supports us across between 300 and 350 acute hospitals spread out across the country, and many thousand community and primary care services. And working within the NHS, we've got about 1.4 million staff across about 350 different roles. A large proportion of those will be in our roles delivering clinical care across our different doctor specialities, nursing specialities, allied health professionals, people working in psychological therapies, which is my background, and many other supportive clinical roles as well. And it's quite critical that we are making sure that people across all of those different roles have the skills, knowledge, behaviours and attitudes that we need to deliver effective care, and that we have a continuous supply of newly qualified clinicians being made available to that workforce to continue to support it, both its expansion, but also to, of course, replace people who leave working in their different clinical roles. And so I work with an organisation called Health Education England, and that's one of a number of national bodies. Health Education England's focus is specifically on making sure that we have the supply of workforce that we need, again, with regards to the different roles that are required, but also where we need them to meet demand across the different locations, across the different hospital settings, etc., spread out across the country. And we do that by providing education and training to support them through commissioning our universities, or through managing the training of doctors who are newly qualified going into their postgraduate education into their different medical specialities. And within Health Education England, I lead a team, a specialist team, that is focused on how we can support the way we train and educate through the application of learning technologies and simulation-based education approaches. Now, across the last 18 months, through the course of the last 18 months, you'll all be terribly familiar that the COVID pandemic has had a particularly pernicious impact on all aspects of the way we're able to effectively deliver healthcare. And one of those areas that's been significantly impacted has been our ability to train and educate people. People who have been within their education pathways have been pulled into needing to be part of the workforce on the front line delivering care, either to being pulled into a significant expansion of critical care, or being pulled into supporting vaccination rollout, or being pulled into supporting the recovery of clinical care has been attempting to recover things like elective surgery or cancer diagnostics, etc., getting back on track and meeting all the other breadth of healthcare demand needs that, of course, do not stop because we're in the midst of a pandemic. So, alongside this, we've also had the need to continue to implement government mandate objectives, for instance, and ambitions, which are all about how we can, well, lots of them are about how we can continue to reform, we train, educate people, again, striving towards attracting people into clinical roles and enabling them to acquire the skills that they need to work within modern day healthcare, and equipping them for what that means in terms of future skills that are coming, that we need to start to build the foundations of as we move towards an increasingly technology enhanced way of delivering healthcare. And so not just the ability to, we're not just trying to address the needs to recover education and training in the very short term, but we also have the need to implement new ways of training the education to address those future skills requirements, but also to expand our training capacity as well, so that we can try and increase the number of doctors and nurses and people across those roles, because as we're all familiar, and this is a global issue, that healthcare demand is going in only one direction, and the challenges to develop and provide that workforce and get that in place to deliver that care is increasingly becoming more and more challenged. So the work within our technology enhanced team, the team that I'm in charge of, we've got a number of things that we're trying to achieve as sort of high level objectives with the work with regards to learning technologies and simulation. That's one to point out here is how can we support the system to increase placement capacity. We're limited by the number of supervisors, mentors, education faculty that we can have in place at any one time, but how do we build efficiencies into the system so that we can expand and enhance those placements and increase the amount of clinical exposure that they're getting whilst they're within training, either undergraduate or postgraduate education. But equally, how do we continue to enhance that experience? How do we facilitate them to gain the knowledge, skills and competence that they require, but to do that in a way that increasingly removes the friction from that experience, both with regards to educators, but also with regards to learners. And through the course of doing those two things, how do we make sure that we're continuing to strive to improve learning outcomes and enhance the both that experience of education, but especially in terms of the ability to continue to improve on patient safety. We see that a really important role for the use of XR technologies in supporting us to achieve those ambitions. We're really, really excited, to be honest, about the potential of XR to both really enhance that learning experience, really enhance the ability to acquire and to sustain new skills and knowledge in our learners, but also, and critically as well, to really expand that training capacity, the ability to acquire clinical experiences. There's a number of examples here through which we're seeing some great applications of XR technology. I know many of you have been in previous talks which have gone into some detail through the day around different applications, and some of those that you're seeing on the screen here might be familiar. We're seeing, for instance, just from working across from the left, great applications of the HoloLens, for instance, using technologies like remote assist to be able to broadcast ward rounds or patient consultations out to learners. There's good examples of how this has been used within COVID hot environments, which has enabled people to bring in more junior colleagues into that clinical space without exposing them to the risks of being around patients who are COVID positive, but also making that experience more comfortable for patients as well, yet not diminishing and in fact actually enhancing that as a learning experience. And fabulous to applications of that technology, being able to bring in some of those additional bits of information, such as X-rays or DICOM images, into that viewing space for those on the receiving end of the consultation, maybe who it's being streamed to, but also the clinician who's engaging with the patient in the room as well. We're also sort of, if you look within the middle there, seeing some further, I think, really interesting applications. This is again using Microsoft and their HoloLens, and using their Microsoft Guide application within that. And this is an example from an innovation at the University of Michigan, which is where they've created a standardized approach to teach lumbar puncture in this example here, using mannequins, but bringing in that mixed reality capability on top of those, and being able to take learners through the ability to practice learning how to gather those skills, gain that mastery around, in this case, doing lumbar puncture. Now, what that's meant for them, and what we're seeing in England, is interest in being able to basically have multiple learners, excuse me, multiple learners at any one time, taking huge weight off of education faculty, but being able to really, scale up the throughput of learners, but at the same time also facilitating them to have great consistency in terms of the procedural approach that they are being walked through, for instance, again, within this case of doing a lumbar puncture. And then the last one on this last example on this page is where we've working actually with some of our national programs around supporting, in this case, people learning skills to work with new mothers who may have perinatal mental health problems, and how can we, in this case is how we can use an immersive experience with a standardized patient avatar to train clinicians and healthcare workers and social care workers to be able to learn how to effectively have a consultation with somebody who's presenting potentially with some mental health problems, in this case, post having given birth. Now, this is a really neat example using some technology developed through a company called JoinXR, Project Agrios, this is called, and this is enabling us to run those consultations through that immersive experience. And in this case, using the JoinXR platform, we can have multiple individuals located within that immersive experience. So you can turn that into a really, a multi-user learning experience. We're looking at the application of that immersive learning environment for how we might train our general practitioners, as well as a multitude of different staff, as we immerse them in all different learning scenarios. Thank you, Josh. So we're looking to scale what we're doing and at some pace across the country. We're looking to encourage our educators to integrate XR technologies in the way that they educate and train, and to expand their horizons around the potential of enabling us to do things differently and to gain all the sorts of benefits that you're aware of. And as we do that, we're incredibly mindful that, working as a national body, we've got a responsibility to ensure that we are putting in place the sorts of structures and parameters that we need, we need to have to ensure that quality is being managed, that we're getting a level of consistency in terms of the way that people are applying and using these technologies. And we also see these technologies as being part of a suite of techniques and technologies that can be applied within that stimulation approach. And to help us make sure that we're managing a level of consistency, and we're bringing people with us, and we're enabling those sort of quality structures to appear. We produce a range of policy documents and guidance documents, and there's an example on the screen here. So, a few years ago, we produced a national framework for simulation-based education, and more recently, we've published a strategic vision for how we see the need to scale the adoption of immersive tech within that simulation approach, but also opening up to decision makers around the system who may not be familiar with simulation and immersive technologies, where we might see some real benefits if we start to integrate those practices into those areas. Now, we don't just have great ambitions in this space, and we're not just able to identify certain great case studies, of which doing that is very useful because it helps us raise awareness and pique people's interest. And we don't just publish guidance and policy in this area as well. We've seen that there's a real need to create capacity in the system to develop the ability for colleagues around the NHS in all their different settings to be able to access the hardware and the software applications, to be able to start to test out and to gain confidence and capability in how they might adopt XR technologies in the way we train and educate. It won't just happen overnight. The NHS is a very fragmented system, although it's centrally funded through tax. It's still very much a federated system where institutions and bodies have their own budgets and make their own decisions in terms of how they might spend that money. And that's included on how they might go about adopting different ways of training, educating people that they're responsible for. But not all organizations have deep pockets, have significant budgets that they can bring to bear to, whether it's about dipping their toe in the use of XR technologies, or developing and investing in enough equipment to be able to effectively integrate that into their educational approaches. So we've created an offer to the NHS where we've invested in a central repository of XR technologies, of XR hardware, and the ability to bring in a range of applications that have efficacy in supporting healthcare education and training. And this is what we've coined our XR hubs. So really what we're describing here is a virtual library where organizations around the NHS can pull down, can access through a loan arrangement the technology that best meets their educational needs, and we can support them in that application. So they are either getting exposure to the benefits of XR, they're learning how it best operates within their environment, or we're supporting them to overcome the barriers to be able to effectively integrate that into practice. But more importantly, where it comes down to its efficacious application within healthcare education, its delivery, we're supporting them in thinking about how we get that pedagogical effectiveness, how we integrate that really effectively into that learning environment. It's also enabling us to generate evidence at some scale as well. So a precursor to being able to being allowed to access the technology and bring that into their own environment is that they need to agree to also evaluate its utility and to give us some feedback on the benefits that it brings, but also help us understand some of the barriers of adoption as well. Now, a few more slides from me, and just to cover off some things that we think are critically important really in terms of being able to see that safe, efficacious adoption of XR technology at scale across England, across the NHS. We know that we can't, it's not just about putting policy in place and enabling access to the kit itself. It's also about making sure that our educators and our educational faculty have the confidence and the capability they need to bring that into that educational environment effectively. And so there are a few things that we're looking to do to really maximize, or at least build a foundation of knowledge and skill across the country, so that we can maximize that that efficacious, that safe integration into practice. So we're doing that through some faculty development initiatives. We're developing a national faculty development program, which is looking to raise the bar, raise the fundamental knowledge that we have in place around safe use of simulation and how you effectively use simulation, and in this case, how you bring in those XR technologies to help them to do that. Alongside how we support our educational faculty, we're also supporting our technicians as well. So simulation is best enabled through through knowledgeable educators, but also through our technicians who need to have the skills they need to manage that simulation environment. And in this case, we've got we've got to be supporting our simulation technicians to feel really confident and skilled in bringing XR technologies into play as another medium through which they can support simulation through. And what we're also hoping to achieve through that is not just are they able to bring that technology into their own environment, not just are they able to understand how they can support learners and educators to use the different applications that are available. We're also interested in how we can support them gaining that the confidence to create their own content over time, and understanding what locally created content, what it needs to make locally created content, whether that's 360 video or starting to create CGI content themselves, and how at a local and regional level they might start to develop and really expand the capability to be able to enable them to do that, to further enhance really the opportunities. Moving on to in fact, oh, I thought I was on that slide. Apologies, folks. We'll move on to the next one, Josh. So I mentioned before that alongside, well, to enable us to effectively support the adoption of XR technologies, we need to make sure that it's effectively working within the different environments where it's going to be utilized. And we've got quite a variability across the National Health Service estate in terms of the level of sophistication of that IT infrastructure. But what we do have is a huge amount of energy and will to continue to improve that. Now, there's a lot going into supporting, enhancing that IT infrastructure around that around our clinical care systems. And quite rightly, they are getting the majority of the focus and investment. But we also want to make sure that the education environment is effectively keeping up. If we've got high expectations of the use of learning technologies and XR technologies, we need to make sure that it's going to be working effectively within whatever environment that our learners are going to be placed within. And so to support us in that, we're developing a technology enhanced learning maturity model. And we're working with organizations across the NHS to benchmark their levels of maturity against this scale, and to understand where those barriers are to effective adoption of learning technologies, where those barriers are to being able to make sure that XR technologies are going to be usable within the environment. And of course, critical to this is to make sure that that includes being mindful of the necessity to be responsible for cybersecurity and maintaining that integrity of any data that's being captured through that usage. One of the last things I wanted to share with you um, is a little bit of information around what we're doing to put a further wrap around, I suppose, our ability to support that safe adoption at scale with regards to XR technologies. And that's how we want to use our national learning platforms to help us with that. Um, due to I think the rather, I suppose, in some ways, the unique makeup of the NHS, we have the ability to deliver a number of systems comprehensively across the country to support clinical delivery and support education. And my team is responsible for an aspect of that. We have a number of national learning management platforms that we are in charge of, and we continue to build and develop for the NHS. And we've got about 2 million learners that we support through our national platforms across all the different organizations. And our latest platform, our latest initiative around how we can keep enhancing the sort of capability and functionality we bring to bear through these through our national learning platforms is the Learning Hub, which is going to be the center of a comprehensive learning ecosystem for health and care in the near term. And we're going to gradually improve the capability and functionality. We deliver that over time. One of the things we want to build into this is the ability to share and disseminate XR content. If we're going to see, again, successful adoption at scale, we want to make sure that we're enabled to, we want to support collaboration and sharing across the system of innovative content, bring people together to create content together themselves, and make sure that we get maximum efficiencies of all the effort and investment that's made into any content at any one time. And we see the Learning Hub playing a really important role in supporting us of doing that. And that may be, might be Microsoft Guides, for instance, or sharing 360 videos or rendered 3D models, all sorts of different content is going to be shared via that out to all of our learners and educators. So thank you very much for listening to me today. It's been a really interesting experience presenting with within this space. It's been an interesting day for me. I had some technical problems, and I was also juggling trying to create some responses to some national system leadership within the NHS. So I appreciate my delivery this afternoon or today for you was a little bit stop-start, but I hope you've taken away some interesting messages about some of the ambitious plans that we've got within the NHS and what we're trying to support from our national role within our technology enhanced team at Health Education England.